What does it take to turn a neighborhood taco shop into a movement for women's health? During this episode, we sit down with Sharon Haynes, artist, restaurateur, founder of Tacos A Go-Go, and so much more. She's journeyed far beyond Tex-Mex. She's built a business rooted in community, resilience, and has a fierce support for women at every stage of life. Sharon shares the inspiration and determination it takes to put women's health front and center. She says it wasn't her own experience with breast cancer that encouraged her to create her famous pink tacos or host a mobile unit at her place, but instead a deep belief that women matter. Tune in to hear how Sharon built Tacos A Go-Go from the ground up, the creative ways she brings healthcare to her team, and why women's well-being is the heart of her business. And don't forget to subscribe, share this episode with friends and family, and help us amplify stories that matter. Your support spreads our mission, and it could save a life. Let's talk about your breast. A different kind of podcast presented to you by The Rose, a breast center of excellence and a Texas treasure. You're going to hear frank discussions about tough topics, and you're going to learn why knowing about your breast could save your life. Thank you, Sharon, for being with us today. You know, I've been doing some research on you, and you are a very interesting lady. I mean, you have done a lot of different things. So tell us, first of all, about how the heck you ever got into creating something like Tacos A Go-Go.
So I have always been an artist without a medium, is how I think of myself. So I've dabbled in photography. I worked in New York as a freelance photographer assistant and helped photographers all over New York City. I got into welding when I moved to Houston, and I had a welder's workshop and in an art studio over on Commerce Street. And but all the while, I sort of supported my art habit with working in the industry, in the restaurant industry, so mostly as a bartender. And so at one point, I was working in a bar with a friend of mine, and we decided we were going to open a bar together. And we ended up finding a beautiful old building in downtown Houston that was called the Henry Brashear Building, that was built in 1880. And it was a 3-story building right behind the Rice Lofts. And there was a perfect spot for the bar upstairs, but it was begging to be a restaurant on the ground floor. And so in the late 90s, we opened up Solero, which was Houston's first tapas restaurant. Back then, we used to get phone calls for people asking about our topless restaurant that we were opening. And I ran that for a few years, and then I started having kids. And so I got out of it. And then a few years later, somebody approached me with a little spot on Main Street about doing a restaurant there. And by then, I had learned that Houstonians want to eat Tex-Mex food for breakfast, lunch, and dinner. And I decided if I was going to open another concept, it was going to be Tex-Mex in Houston because it's all people want.
That's it.
Yeah.
But now, that was a spot that had very limited parking and...
Yeah, it was kind of an insane space to open a restaurant, and that was back in 2006. There was no parking, typically at that point, every Houstonian expects to just pull up in front of a restaurant. Certainly back then, things are changing now, but and we did not have that. It was on the light rail, which also was a very new concept to Houston, but it was right next to the Continental Club and a tiny little taco shop, and just honestly, almost like one show at a time at the Continental Club, we got introduced to new clientele. And believe me, I had many a nights where I was the cashier and cook if needed, and I'd be on the phone with my husband going like, should we keep this thing open? Like, what are we doing? And if I can just make it to $700 a day in sales, then we're going to be okay. And, but yeah, that was almost 20 years ago.
And now you have 5?
Now we have 5 locations, yeah.
Wow. And they're all doing well?
They're all doing well. We have a 6th coming, and yeah. So it is, it's nonstop tacos for breakfast, lunch, and dinner.
Well, of course, I remember the pink tacos that you did for the Rose.
Yep.
And Sharon, as a great supporter of the Rose, has created a very unique way for us to reach people that we wouldn't reach at all. And we so appreciate all of your support. But let's talk a little bit about why you have the mobile unit come out and how you met Lori, how all of that came together.
Okay. Well, I met Lori. She reached out to me. She's a dynamo who works very hard to help women who work in the restaurant industry with their healthcare needs. So she reached out to me years ago, and we started working together on different events.
And Lori is a surgeon. She is a physician. Certainly understands what is going on with the restaurant workers and how difficult it is for them to have insurance.
Right.
So she really is on a mission.
And she's amazing, and her husband owns restaurants, and so her passion for helping these women, and the women that work in my company are amazing. I mean, they are mothers. They are, some of them single mothers, and they work so hard. And as a lot of us mothers know, and especially those that work as hard as these women do, that their health is not a priority, and until all of a sudden maybe there's an issue, and that's the kind of thing that Lori and everyone wants to avoid, right? So there's a lot of preventative things that you can do, or of course in this case it's early detection, and so helping give access to that is amazing. And
so you didn't have an employee that had need or anything like that, did you?
No.
Okay.
No, but I did. So, in 2020, I was diagnosed with breast cancer, and I was a couple months late in going for my mammogram because it was spring of 2020.
Right.
And so I didn't go until the fall, but again, I was very lucky that it was early detected. And, so I've had a very good outcome, but that, of course, as you know, is a major, major factor in not only breast cancer, but a lot of cancers if you can detect early.
And there was no way you could have really gotten in that spring.
Yeah.
So, but you were always on top of your mammograms. You believed in that early detection, prevention. So many women put it off for way too long. So I'm glad that you were able to go on in when it was back to almost normal.
Well, and I think, again, we live such busy lives. Again, I have a tender place in my heart for working women because the minute you have kids, everything comes before you, right? And so when it comes to healthcare, no one is going to take care of you like you. And I really think that's an important message for women, especially because I think they tend to put certainly their children before they do. I know some women who take their dogs to the vet more regularly than they might take care of themselves by getting checkups. And I just think that we tend to not prioritize ourselves. And there is that, wonderful thing that you hear every time you get on a plane, that if you're traveling with a child, that you need to put your oxygen mask on first because you can't help your child if you're not healthy and good. And so I think there's a lot of value in encouraging women to take care of themselves first.
But Sharon, as you're talking, I'm hearing almost a different story than I've heard before because it's kind of like we think we're invincible.
Right.
I think women are smart. They know they need to do this. But, well, I'm okay, but I'm going to take care of the child, the dog, the husband, the whatever.
Yep.
So I wonder if we focused a little more on it doesn't hurt that you're not invincible. It doesn't hurt anything that you're taking care of yourself. Because this is a problem we've had for almost 40 years.
Yeah.
Most women will not come on time, and I'm not talking about because of a COVID thing, but most of them will wait 14 to 16 months before they'll have that annual mammogram. And that's when you get into that little scary spot that things could change.
Right.
So,
and there's it's not going to happen to me like that. That is very, if we lived our lives thinking that all bad things were going to happen to us, we wouldn't get out of bed in the morning, right? So I think it's very normal that people think this is not going to happen to me.
Right.
Like I'm fine. I'm healthy. I feel good. Like,
Right.
so there is that. But then, when you get that diagnosis, I have no history of breast cancer in my family. I don't have any friends that have gone through this. And so, it is the kind of thing like, oh, wow, this can happen to me. And of course, it's terrifying when you hear the C word, and it comes with all sorts of baggage. I struggled a lot with somehow this is my fault. Like I didn't eat healthy enough, or and I think in this country, but not only, I think, people tend to, I don't know, like I shoulda, coulda, woulda, like somehow this is my fault. And even with something like breast cancer, which of course it's not my fault, but I definitely struggled like, what did I do to bring this on to myself? Like what should I have done? I should have, not done this when I was young, or not done that, or, I don't know, eaten a little better, or cut the sugar out, or alcohol's a carcinogen, so maybe I shouldn't have had those drinks, or, you do tend to like somehow blame yourself a little bit.
oh yeah, I hear this all the time.
Yeah. And so finding that forgiveness, and also just learning that's not the case, right? Like I didn't do anything to bring this on, and so there's a lot wrapped up in it, and
But that's a very important part. We have no idea what causes cancer. I don't care how much you hear about, eat this or don't eat this.
Right.
We still, we've had athletes show up with stage 4. People who do nothing but take care of their bodies, So no, it's something we still don't have our hands around.
Yeah.
We don't know why.
And for me, a big part of it is the restaurant business, right? And stress, and it's 24/7, and the phone rings in the middle of the night, and the alarm's going off, and then I go, oh, it's because I live a stressful life. Like I don't do enough yoga, or I don't, like whatever.
Wow, you went down all of the rabbit holes.
It's very easy to do, and especially when you just don't expect that this is going to happen to you. Like, right? It's not supposed to happen to me because I eat well, and I take care of myself, and I go to the doctor, and I, blah, blah, blah.
Right.
But it happens, and...
So have you had any employees that have been diagnosed?
Nope.
Oh, that's good.
Yeah. And it's just great to be able to offer to get them into that mobile
Absolutely.
mammogram, and to make them understand, the importance of just going for this very simple test that can really change the course of, if they were to get a positive, that they could change the course of how it goes with early detection.
One of the things that we've noticed since we've had the mobile mammogram unit at your place, and thank you so much for providing that space.
Pleasure.
You just don't take that big old 45-foot vehicle anywhere. Right. But one of the things we've noticed is that it's usually not filled up until about 3 days before.
Right.
And I would just struggle with that. Here's a free mammogram, and why aren't these women coming? But it's because they don't know their schedules.
Right.
I mean, most of us don't have that issue.
Right.
We know that we can get off work to go do something.
Yeah.
But in the restaurant business, that doesn't happen.
Yeah.
Many times you don't know what the schedule's going to be. So, but invariably it fills up. And I think that's the blessing of it being there.
Yeah, because it really is disappointing if this opportunity is there and women aren't taking it. I think that is a hard pill to swallow. But, again, our staff, for the most part, they have set schedules. Everyone knows it's just a priority thing. It's like, oh, I'm going to stop and I'm going to do this thing for myself. And for them to understand how important it is. Because I think, again, a lot of it is people just don't know the importance of getting a mammogram, I think.
And do you find yourself explaining that to them, or just
yes, because I'm a case in point. So when you are in when you've had it, it's much easier to explain the importance with, a real, depth of meaning behind it, because there's a personal story right in front of you. And that obviously has power.
So we've been talking about Lori, who is the founder of I'll Have What She's Having. And she doesn't just provide breast cancer screening, but she has many other screening services that she offers. And it has been such a gift to the restaurant workers, I know.
It's incredible. And she's also sort of moving into some mental health support. And
yes.
She's helping me right now with one of my long time cooks who's having issues with her daughter. And she's amazing. And I can just turn to her like, how can you connect me to somebody that can help this woman? Because, these are people who, don't have easy access to our medical system.
But, mental health is very hard for women also.
Yeah.
I think it's almost the same, not I should have done something different, but I can handle this.
Right.
We don't want to find help all the time, even though it's so needed.
Yeah. And I will say that I think all of those things, including the healthcare issue, the mental health care, I think that's changing. Like, I think the younger generation is really much better at taking care of themselves and speaking up for themselves, women in particular. I really am encouraged when I have 2 daughters, and I mean, they're young adults, but it's really exciting to see how they are different than my generation. And it is wonderful to see, because I do see a difference in that stoic and kind of, we have to do everything. And my mom was that way. And, and it's kind of nice to see them put themselves first, which is unique to my perspective and how I was raised.
And are most of your employees on the younger side?
It's a range.
It's a range.
Yeah.
I'm just curious how easy it is to get that 40-year-old in there for that first mammogram.
Yeah, and then those are the ones that need it, and they still are on the cusp, sort of
But we don't think anything about having a pap smear. It just drives me nuts because, a mammogram is truly non-invasive.
Right.
And it's just a little bit of awkwardness for a few minutes. And so any tips you have on how we could reach younger women would be great.
Yeah.
That is the one area that we need to work on.
Well, and for me, what I see with my girls is that I think, and even me, because, like, when do they need to worry? If they have a mother who's, had breast cancer, like, is that, even though mine is not, I haven't had the test, but I don't believe it's genetic, but, like, at what point do they, like, I feel like some of the messaging around, like, when you're supposed to start, how, like, because, I don't know that I know that. I don't know that they know that.
And it's because we've had so many different controversies about mammograms to start with.
Yeah.
And then they changed the age recommendation.
Right.
How many times in the last 20 years it's been changed? For some reason, they went back to 40 years old.
Huh.
I guess it was all the women that were dying of late-stage cancer in their 40s who had thought they didn't need to start having their mammograms. I mean, it truly was an awful, awful time when that age recommendation was 50.
Interesting.
But now, reluctantly, they've gone back to 40. We believe women should start earlier.
Okay.
We really believe you ought to have that baseline at 35. Your daughters need to have it at 25.
Okay.
Just because.
Yeah.
And it wouldn't hurt to do the genetic testing.
Right.
By the way, we do that here, so.
I did ask my doctor, and they seem to think that I don't need it. And my gynecologist thinks I need it. And I've talked to other people that are like, get the testing. And maybe I'll schedule an appointment.
Well, that would be good.
Yeah.
Honestly, we've seen so much that it can show other things, but it's really important. It might change your surveillance a little bit. You might do it a little bit often.
And for my daughters is really what I care about.
Oh, yeah.
And, yeah, for sure.
Even though there's still a lot of work to do in that area, too.
Yeah.
All right, I want you to put back on your business hat.
Okay.
What does it take to have your own business and one that is so demanding?
So, I think I'm an entrepreneur at heart. Like, I see opportunity. And obviously it's what I know, right? What it takes is just a tremendous amount of hard work. I mean, like, that is what it takes. And I think, it takes, of course, it takes common sense. It takes focus. It takes organization. And, it takes humanity. Like, for me, that's a big part of how I run my business is through humanity. Like, treating every single person that works for me, with grace and support where I can and when I can and how I can, and understanding and having a perspective of every single person that comes to me is coming from a unique place that is going to inform them on how they behave, and whether it's someone's first job and so they might make a mistake by not showing up because they thought, a lot of how I operate is I would not be where I am with my businesses if it weren't for every single employee that I have and have had that have gotten me to where we are. And they're people with lives that are working hard to help us succeed as a group. So, for me, that's probably the biggest thing. And hard work is the other one. Like, it is a true dedication. And the restaurant business is funny because a lot of people, most people, go to restaurants, they eat out, they know what they like, and they think, well, I can do that, that looks like fun, well, it's not, and even everybody that works in the restaurant, everyone I know, it is a love-hate relationship, right? Like, I love the business as much as I hate it, right? Because those negatives of customer reviews and someone who gives you a 1-star review because, whatever, something went wrong and, a human made a mistake, or, I don't know. And you get a review right before going to bed and it's a 1-star, and then you're just, or the phone rings in the middle of the night because there's glass break and somebody's, and then you're calling the cops and you're getting out of bed and driving to that location and or somebody doesn't show up or somebody quits unexpectedly. These are things that you absolutely detest. I detest about the business,
right.
Because we're open from 7 a.m., which means some days my staff gets there at 4 a.m. if they have catering. And they're there till sometimes midnight, sometimes later. And so if they need me, I am there. And so, that part is really, really hard.
Yeah.
And I've been doing it for a long time.
Right. So it really is breakfast, lunch, and dinner.
Breakfast, lunch, and dinner. And not all restaurants are, but mine happens to be.
Yeah.
And last week, twice in 1 week in one location that does a lot of catering, our original location in May, no power, center point, a planned outage that I guess they failed to share with us. And, we have all these catering orders. It's 5 o'clock in the morning, so that part is not fun.
No.
But
no.
Opening a new restaurant and celebrating Mother's Day with our staff, and there's obviously a lot of really great things about owning and operating restaurants.
So how did you celebrate Mother's Day, or how do you celebrate?
So we've done it a whole bunch of different ways. We've had mothers come to one location. So this year, every store is kind of doing its own thing. And we buy flowers and, and, bath bombs and just things that we feel like could help make the mothers feel appreciated because in my book, and I'm one of them, obviously, but, no one works as hard as a mother to have a full-time job and then to, be the primary caregiver of their children is, and not to say that there's not some men out there that do that too, because I know there are, but the lion's share of them are working mothers, and it's a really, really, really hard and demanding thing. Right. And so we're kind of celebrating in different stores or doing different things.
Yeah. And your own employees, many of them are working mothers, I imagine.
A huge number of them are.
Yeah.
Yeah. We have more women working for us than men, and many, many of them are mothers.
I remember at the Rose many years ago, we were trying to get a new phone system. And so we had these people come in and look at our phones and, what we were going to need. They were evaluating different companies. And this one guy came in and he said, "You don't need a new system. You don't need more lines. You need to get these women off the phone. They're calling their children every afternoon." And I went, "They're calling their children to make sure they're home and safe."
Right.
And I said, "We have, 80 working mothers here. Of course they're going to call their children."
Right.
He didn't get the job. But, it was like,
good for you.
My gosh, that's what we did.
Yeah.
I was a working mother. I checked on my kid every afternoon. So, it's what you do.
Yeah.
Yeah. So what other, and I was so fascinated by your story. I was thinking, if you had a young woman about to go into her own business, or an older woman, besides the hard work, what else would you tell her that she needs to be prepared for?
It's changed a lot since I've been in the business. Back in the day, we didn't even have a computer system. I think there is a technology piece and like a social media piece that I think has really, when I say social media, I mean reviews like Google and, and any business is open to those, right?
That's right.
And those things are, didn't used to be there like when I started, And so I do think, making sure that you are going into it with eyes open in terms of like just being aware of like all that comes along with the business that you want. I think having a passion for what you're doing a business in is really important because you will get sick of it and it becomes your living, breathing child almost really. And so going in with eyes wide open and making sure that you have some good support and knowing like sort of what you're getting yourself into, I think is important.
Yeah, I agree.
Yeah.
People always say, "What does it take to start a nonprofit?" And I just say, "Don't."
Yeah.
Interesting. It's just, you just can't imagine all the different things that you're going to face.
Yeah.
So one more time, we want to talk just a little bit about you having the mobile coach at Tacos A Go-Go. It's usually at 1, right?
Yes.
Yes.
We do it at our TC Jester location in Oak Forest because it has a nice big parking lot out front, and not most of ours don't have that. Right. We might have some alternative locations here coming up, but for now, that's the one that makes the most sense.
You do it twice a year. What?
Just now, twice a year, which is really exciting.
Yes.
And so we've been doing it in March and December, I think.
And it's a part of your collaboration with I'll Have What She's Having.
Correct.
Yes.
Yeah.
And I think we serve about 50 women between those 2 days. Easy, yeah. So that's amazing. It is just so nice to have somebody in the community who understands and has made it possible because, again, we couldn't reach those women.
Yeah.
We don't know who they are. There's no way to reach them, and you're making that possible, so...
Yeah.
Thank you so much.
Well, it's a wonderful opportunity, and thank you because, that it's nothing on our end, in my opinion, and it's everything on your end. So it makes a huge difference, and it's just an amazing thing to be able to offer women who don't have access.
That's true.
Yeah.
Well, thank you again, Sharon, for coming and talking to us about business and about mammograms and your own journey.
Yes.
We really appreciate you.
My pleasure, and we appreciate you.
Thank you.
Thank you.
Thank you for joining us today on Let's Talk About Your Breasts. This podcast is produced by Speak Podcasting and brought to you by The Rose. Visit therose.org to learn more about our organization. Subscribe to our podcast, share episodes with friends, and join the conversation on social media using hashtag Let's Talk About Your Breasts. We welcome your feedback and suggestions. Consider supporting The Rose. Your gift can make the difference to a person in need. And remember, self-care is not selfish, it's essential.